Hello, I'm Dr. Aaron Gwillem from the University of Miami, Dr. Philip Frost, Department of Dermatology and Cutaneous Surgery. This presentation is on professionally developed resources compared to artificial intelligence-generated patient education material with a special focus on melanoma resources. Now let me talk to you about a problem, which is low health literacy, which leads to not using necessary healthcare services, and it negatively impacts health outcomes and leads to health inequities. In fact, patients with a low level literacy are 1.5 to 3 times more likely to experience a poor outcome. And what about dermatologic patients? Well, a positive correlation between increased age and low health literacy has been defined. And in a sample of 92 dermatology patients, approximately 1/3 had low health literacy, with the mean age of the most limited healthcare literacy to be 72, and those with potentially limited literacy, 67. And about 44% of the time, patients overestimated their understanding of material reviewed. And what they do not understand can lead to litigation, with common causes of litigation being lack of proper informed consent and issues related to cosmetic outcome. In fact, dyschromia was the most common adverse outcome alleged in lawsuits. Now, with increased utilization of electronic communication, we see a greater dependence on the written word, and previous studies have shown that many patients lack the literacy skills required to understand much of what is written for patient education, even in dermatology. Now, the AMA and NIH suggest that patient educational material should be written at the 5th to 6th grade reading level, and we have not yet met that, and this is a problem that's been repeatedly defined, however not yet solved. Now, we explored Melanoma Patient Educational Material, PEM, on the American Academy of Dermatology and the American Cancer Society Patient Education sections. And we want to know, are these written at the recommended 6th grade reading level? And then, we calculated the reading level that generative artificial intelligence, GAI, large language models craft their responses, including ChatGPT 4.0, DocsGPT, or Doximity GPT, and BARD, now known as Gemini. We wanted to measure the adaptability of GAI models when prompted to respond in a literacy-sensitive manner. And last but not least, we calculated the JAMA benchmark criteria for all sources, this is on a scale of 0 to 4, to determine the information quality and transparency. Now, we took those 25 common clinical questions and the answers from the AAD website and American Cancer Society website patient education sections and compared them to generative artificial intelligence platforms including ChatGPT, Doximity GPT, and BARD, now known as Gemini. And we calculated the educational level required to read the patient educational material using objective measures, Sydney Health Literacy Lab, or SHELL, and the Flesch Reading Ease Scores, or FRES. For the generative artificial intelligence models, after the first response, a literacy-sensitive prompt was given to assess its adaptability. This included instructing it to respond at a 5th grade readability level, and a clinically significant increase in FRES readability is 17.4 points, as previously described in the literature. Our results show that the AAD website had a FRES of 52, ACS website 58, ChatGPT 44, DocsGPT 35, and BARD 56, with the corresponding grade level listed to the right. After the literacy-sensitive prompting to the generative artificial intelligence platforms, ChatGPT had a FRES change of 34.3, DocsGPT 24, and BARD 10.1. ChatGPT, without additional prompting, saw no responses that met the 6th grade reading level, but with specific literacy-sensitive prompt engineering, 13 or 52% met the 6th grade reading level. When comparing the JAMA benchmark criteria across platforms, we saw the AAD website have a 2.62, ACS website 3.8, ChatGPT was unable to meet any of the benchmark criteria, DocsGPT 3.5, and Bard provide the best JAMA benchmark criteria results with a score of 4. In conclusion, the professional websites did not meet the recommended reading level, and our top performing generative artificial intelligence platform, ChatGPT, started out with an average reading level being college, but it was able to increase the FRES or readability by 34.32 points, resulting in an average 7th grade reading level, and this is a clinically significant change. ChatGPT and other generative artificial intelligence platforms can fill literacy gaps, offering targeted responses based on individual patient needs. This shows potential as a valuable resource as we can now easily improve readability of responses. And with increased readability, it can help improve comprehension, and with that, a better understanding that can potentially improve care and more compliant patients. This ultimately has a potential to improve health equity. Thank you for your kind attention. The full data and results will be released in the forthcoming manuscript. And I'd like to take a moment to thank the study team, Olivia Burke, a fantastic medical student at the University of Miami, and Dr. Kayvon Nuri, our mentor. If you would like to collaborate, please scan the QR code and let's talk.